Very accomplished nurse, doctor of nursing practice, who is currently an innovation specialist within the Central Arkansas VA healthcare system, and who has been using immersive technology in practice for a number of years. And I had the honor of meeting her many years ago, it feels like now. I think it might have been 2019. And she has really been pushing the boundaries of what you can do with this technology across many different end-user populations. So please join me in welcoming Dr. Megan Rumsey to the stage.
Can I take your microphone?
You can.
Okay, thank you. So thank you so much. The title of my presentation, and this is to engage, we've been engaged in one hemisphere this morning, and this is to engage in the other hemisphere. So Applied Wonder, walking a mile in the shoes of our Central Arkansas veterans. And I just represent Central Arkansas, but this could be representative of many VAs. So I walk in the shoes of many colleagues that are doing this similar work, and it's my privilege to share two veteran stories. You can't make this stuff up because Dr. Riley was just building the case for hope. And so I hope that you leave this discussion with an actionable example of how hope can transform our veteran experience. So I wanted to just start to give you the definition of hope, because I think it is profound, and I will make echoes back to this in the examples that I provide today. So hope is a feeling of surprise mingled with admiration caused by something beautiful, unexpected, unfamiliar, and inexplicable. When I am working with, I am the innovation specialist, so my job is not as a provider. My job is to reach out to our frontline staff and to, of course, work with our veterans. And when I have been in other roles, I have worked directly with our veterans. So my staff know about this, and they have asked me to use some of my expertise in immersive technology to work with our veterans that are maybe perhaps with some severe chronic pain or with other situations that I'll explain. So when we're thinking about how we immerse our veterans, the three things that I would like you to know as we travel a little southwest to Little Rock, Arkansas, and John L. McClellan Memorial Hospital, is to think about a couple of different things. One, as an innovation specialist, my role is to teach about storytelling and pitching. And so I am not trying to reach your heart, or not your head, but I'm trying to reach your heart. And then the second thing is that this is done in collaboration with the many clinicians and their staff, my other innovation specialist colleagues that do this work alongside me. It's never alone, it's also always in collaboration. And then the third thing is that I have intentional principles about how I show up. The one is that in a courageous way to support our veterans, there's a moral imperative to do this work and to reach beyond the known to make sure that it's done in a safe way, but also in a way that honors them. And again, that veteran-centric approach. So I am going to introduce you to Mr. C. So Mr. C was admitted to our hospice unit in November of 2023. Mr. C is a self-proclaimed bachelor and lived alone in rural Arkansas. So he came to the facility, and his disease progression was so severe that they said, we can't return you to your home, you live by yourself, you won't survive an amputation, so we're going to keep you here. So obviously that was incredibly distressing to this gentleman. Our typical length of stay in our hospice unit is 7 to 10 days. So November passed, December passed, January. The staff asked, would I be interested to come and do some immersive technology with him. So I came, I showed him what I had, the different headsets, and we started building a relationship. Mr. C raises wild cats, so not the small cats, but lions, tigers. That is what he was doing. So he is somebody that lived of the world. He's an Air Force veteran. And so we started to really lean into the things that he was excited about, which was travel. I had a headset that could use Google Maps, and we just started making the list and traveling the world. So we started at his home. We started with his elementary school, and then we thought beyond that. So here you can see him. It's February, so he's been in the hospital since November. So here is the hope. So we turn the calendar, and it's March, and he has that right on his wall, and he's thinking, I'm still here, so what are we going to do? So again, we start thinking about how this portal opens for him to go places he's never been. We went to Alaska, Machu Picchu, we went to China, we have traveled all the continents. And one of my visits, he said, maybe you're the reason that I'm still living. And I knew that that wasn't Megan Rumsey, that this was the experience that we were creating. We were creating this interaction, this love, this validation that he had never experienced in his life. And so the hope, the perspective taking, the engaging curiosity, and you can see there's a little foreshadowing on his shirt because Little Rock was in the path of the eclipse. So that eclipse went up on the calendar. That was April 8th. One side note I just want to share. So the aviators up here on the stage, in March, that commercial started rolling for Mr. C, and he would talk about it often and talk about the experience and how meaningful that was to connect with him and those veterans. And I was able to connect with them and tell them how much their experience meant to him. And that was a really profound experience for me. I have a picture. I'm going to take it back to Mr. C. So here is the eclipse. We made it. And you can see medical media has captured us in the bottom. We're all wearing our glasses. And you can see that's a picture of totality above us. It's hard to see from your space, but that solar flare is in the shape of a heart. So I don't disbelieve, I believe. And so our medical media printed out these pictures, and they're in his room with him as a reminder of how engaged and hopeful he is and was about this experience. We also went to Mount Everest. He climbed across the Khumbu icefall. He swam with dolphins in Cuba and gone into the reef. So we have seen a lot of things. And then he thought, April 8th, I think I'll make it to my 68th birthday. So we just celebrated this last week. And so that shirt was a gift. He had never had a birthday party before, and the staff went all out, and he got a ton of gifts and cakes and cookies and everything that he wanted, and you can see that he's very engaged, and it says, fresh sarcasm served daily, and that tells you all you need to know about this incredible human being. And I posed the question, can you have the best, most engaged days at the end of your days? And Mr. C would say yes, that you can, and that this technology and that intersectionality with humans that engaged can create that. So now his goal is to make it to July 4th and actually July 11th because he wants to see the outcome of the trial. Not a political statement. So that's Mr. C. Now, I want to introduce you to another veteran, and this is Mr. K. So I was asked to go and see him by one of the nurse managers. So Mr. K has a neuromuscular disease. It's quite advanced. He has a trach. He is in a bed. He can only blink his eyes. But his brain is very, very well intact. So we had an initial meeting with the nurse manager. I explained who I was. Would he be engaged? Would he be interested? And he said yes. He typed that in his computer, you can see. So I didn't want to take a picture of him. He was okay with that, but I wanted to share from left to right. It says, this was our first time. He said it was fun. He said it was relaxing. It was awesome. I love it. And in one of our later visits, he said, I said, why do you like immersive technology so much? It takes me places I can no longer go. He's also at the facility. He was not able to experience the eclipse, but I had a experience that I could show him about totality, so he could also have that experience, and he was very appreciative. One thing that I would like to share about this experience that put me totally out of my comfort zone, I've done, immersions with many, many veterans, many different types of veterans, but because he is unable to communicate and couldn't tell me, I'm comfortable, and because he uses his eyes, and I would obviously be covering his eyes. We worked out a way where he could mouth, so I would hold the headset up to his eyes. And I have several different headsets that I use, and so I was really trying to navigate which one works best, which helps with this. And one had a breathing meditation that encouraged the user to breathe, and then you see a beautiful expanse of flowers. And I was reticent to ask him, somebody who has a trach, who is getting support for his breathing, to actually engage in this. And so I explained, this is what the experience is. If it makes you feel uncomfortable, like I'm right here, just give me the sign and we'll move on to something else. But that actually was his favorite experience. And he said it was so relaxing to have that opportunity to be cued, to breathe. And it just underscores to me, again, back to the applied wonder of the nature of this work, that sometimes we don't know what are those opportunities, what are those spaces of connection that can really bring this technology, us, and that veteran all together to improve the quality of their life in the moment. So, I found that incredibly profound, and I am so appreciative of your attention in meeting these two extraordinary veterans. And I just leave you, one of my favorite spiritual teachers is Albert Einstein, and there are only two ways you can live. You can live as nothing is a miracle. You can live as if everything is a miracle. And I choose the latter. And I am so profoundly grateful to be able to do this work. I think immersive technology and that intersectionality with this community to bring it forward, that is the miracle. So I thank you. Safe travels.